Okay, we will talk about skeletal system. Okay, remember system consists of organs, right? Consists of organs. Okay, now for the skeletal system, the organ is called bones. Okay, so the organ is called bones. Okay, so in general, the organs of skeletal systems are called the bones. And there are 206 bones in the skeletal system. And each bone actually has name. So therefore, there are actually 206 organs in the skeletal system. And each organs, which is bone, has their own name. Like for example, there is a bones called the humerus, okay, radius, ulna, there is a femur, for example. Okay, so there are 206 of them, and we will learn these 206 bones later in chapter 7 and 8. Okay. So in chapter 6 today, we will learn the bones as a tissue. Remember, organs consist of tissue. Okay, and there are 4 types of tissue in human body. Now, when we talk about bones as an organs, it has several tissue in it. The most common one is called the bone tissue, which is actually this is a solid connective tissue. Remember, there are several types of connective tissue. One of them is a solid connective tissue, which is bone. Bone as an organ also has the cartilage on it. So cartilage is another connective tissue. Bones also has blood on it. Right? So it has blood connective tissue. Bone also receive the nervous control, so it also have nervous tissue in it. Okay, and of course, bone is covered or protected by the epithelial tissue. Okay, so there are several tissues that present in the bone. But today in chapter 6, we mostly focus in bone as a tissue. Okay, so bone tissue, which is solid connective tissue. Bone tissue, which is solid connective tissue. Okay. Now remember, the characteristic of connective tissue is consists of cell and matrix. Okay, that's the characteristic of connective tissue. It has cells and matrix. Now, for the bones, of course, it consists of cell. Okay, bone as a tissue, it has cells on it. A tissue is a group of cells. So the cells that present in the bone, there are 4 types. There are million of cells, but only divided into 4 types in the bone. The first one is called the osteogenic osteogenic cell. This is actually the stem cell that produce other bone cell. Okay. These osteogenic cells actually will produce the second type of cell in the bone. It's called the osteoblast. Okay. So osteoblast is the second type of cell in the bone. And this osteoblast has a function to build the bone, which is build the bone matrix. Okay, so this is the one that build the matrix. And then the third one, okay, when the osteoblast getting older, then it's changed into cell called the osteocyte. Okay. So this is the bone cell that maintain the compact bone. Okay, so maintains our bones. And then the last one is called the osteoclast. This osteoclast is the one that we can say is destroy the bones. Okay, by resorption of matrix. So it's actually removing the matrix from the bones. So that's the functions and the name of the bone cells. Again, osteogenic cell is the stem cell that will produce the osteoblast. The osteoblast will develop into osteocyte, especially in the compact bone. And the osteoclast is actually coming from white blood cell. So osteoclast is actually white blood cell that stay in the bone tissue. Okay. So the osteoblast will build the bones. It will make the bone harder. Okay. The osteoclast is the one that destroy the bone. It will make the bones become fragile. Okay, you're gonna see these functions again later. Now the matrix. Okay, remember connective tissue consists of cell and matrix. The matrix of the bone tissue, remember matrix consists of ground substances, okay, and the fibers. Okay, ground substances and fiber. And we know bone is a solid connective tissue. So the ground substances will be solid. Okay, remember there are 3 types of ground substances: solid, gel, and liquid. Okay, so the ground substances for the bone tissue is a solid ground substances which is made of calcium. This is a very important mineral in our body. Calcium, it will make the bone become solid or harder. So this is related to this. Okay, harder bone is because of more calcium in it. It's become solid bone. And then the fibers, remember there are three types of fiber: reticular, elastic, and collagen fibers, right? For the bone tissue, the fiber will be the strongest fiber, which is the collagen fiber. Okay, so mostly bone tissue will have collagen fibers. So it has calcium for hardness, and it also has a collagen fiber for strength. Okay, it will make the bone become stronger. So the calcium and the collagen fibers are the matrix of the bone that will make bones become hard, okay, and also strong. And there are four cells. Osteogenic cell will make the osteoblast. Osteoblast will build the bone. And then osteocyte, this is the one that will maintain the bones. And osteoclast, this is the one that will destroy the bones, okay, break the bone. So how to remember it? Okay, that's easy for the one that build the bone. It starts with B, right? Osteoblast. Just remember Bob. Okay, Bob the Builder. Okay, if you watch the children's movie or TV, there is a Bob the Builder. Bob the Builder. Yes, I can. Something like that. Okay. So osteoblast. This is the builder. This is the one that build the bone, make the bone become harder and also strong. Bob the builder. Now, who destroy the bone? The one that make the bone become fragile. It is start with C, right? Osteoclast. So I usually use cat, eh, to remember the name. So cat, if you have cat at home, it will destroy a lot of things at your house, right? Your couch and other, bed, for example. So this is the osteoclast, cat, the destroyer. Okay, so it's very important to remember the name and also the functions. And I already show you how to make it easy to remember the names and also the function of these different cells in the bone tissue. Okay, now what is the functions of the bones? Functions of bone. Okay, and now bone is a very solid, very hard and strong organs or tissue. Therefore, the first functions will be for support. Okay, and protect, soft tissue or organs. Like for example, our brain is a very soft organs. It will be protected by bone, which is the cranium. Our lungs, our heart is very soft organs, so they will be protected by the bones, which is our rib cage. Okay? So this is first functions of the bone, which is supporting and protecting soft organ. The second functions Okay. The second function will be for muscle attachment. Okay. So remember, we have three types of muscle. One of them is called the skeletal muscle, and this is the one that attaches to the bones, to the skeleton. And by doing so, this muscle will be able to move our body. Okay, so this is for body movement. Okay, so the bones and muscle will work together to move our body. The third functions will be for storage of mineral, mainly the calciums. So the calcium will be stored in the bone. And again, this is the mineral that will make bone become hard, harder. So this is the one that contribute the hardness of the bone. So calcium will increase the hardness of the bone. So people that do not like calcium, do not like milk, for example, when they are getting older, their bones become softer, because they actually do not build their bones when they are younger. So when they get older, their bones become softer compared to the people that drink milk or take calcium. Number four, the fourth function of the bone is for what? Blood cell production. Okay, so blood cell production. Okay, so red blood cell, white blood cell, and platelets, which is all type of blood cell, are produced in area is called the red bone marrow. eh, in the bones. So bone have space, it's called the red bone marrow or RBM. And this RBM is the place for making all types of blood cell, red blood cell, white blood cell, and also the platelets. Last one, the last functions of the bone is for energy storage. Okay, which is actually some fat will be stored in the area of the bone is called the yellow bone marrow. Okay, so yellow bone marrow is for energy storage. Red bone marrow is for blood cell production. So these are the functions of the bones. Now, bone as a tissue, okay, because it's kind of confusing. Bone sometimes is a tissue, sometimes it is also an organ. So they have the same general name. So if we talk about bone as a tissue, there are two types. There are two types of bone tissue. Okay, two types of bone tissue. Okay. The first one is called compact bone. The second bone tissue is called spongy bone. Okay, the compact bone is really compact, really hard, and spongy bone, they have a lot of space, okay, inside that bone. That space is actually the red bone marrow. Okay, so the red bone marrow is located mostly in the spongy bone, and this is the place for blood cell production. Okay, now how the compact bone look like? So if we have bones, let's say we get a long bone like this, okay, so the middle part over here mostly consists of compact bone. Okay, so this is the location of compact bone, which is in the middle part of the bone. Okay, and the spongy bone mostly located at the ends of the bone as an organ. So spongy bones mostly located here. Okay, in the end area of the bones. So that's the place for spongy bone, and compact bone mostly in the middle part of the bone. Now, if we cut this bone, cross section, and look under the microscope, then you're gonna see a lot of compact bone tissue in this cross section. Let's say like this when we cut it. Okay, so this gonna give you this picture, and then the middle one, this is the central canal. Okay, this is the canal, and usually used by the blood vessels and also by the nervous system. Okay, the neurons that will go to this bone tissue. Around that, there will be structure look like a circle, so circular structure. A lot of circular structure. And you did see last time under the microscope, which is part of this bone cross section. Okay, so each of these unit, circular unit, is called osteons. Okay, so this is one osteon, this is another osteon, this is another osteon. So basically, compact bone consists of osteon. Okay, just remember that. That's the unit of compact bone. Okay? Osteon is the unit of compact bone. Okay. Now, if we make this osteon bigger, I can use another uh, slide over here. Okay. This is osteon, osteon, osteon. So we're gonna take one osteon. Okay. Again, it's gonna be the central canal. Okay. And then the circular line. Okay, this circular line is called lamellae. Okay, lamellae. Okay. And then on that circular lines, they will have space. Okay, So this is space, 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 space. Okay, all the way. Okay, this space is called lacuna. You can say this is lake. Okay, and then inside of each space there will be cell. This yellow color for cell. So you see that one? This is connective tissue. The cell are separated. They are not connected, right? So they are separated, and between them there is matrix. Okay, so this is the cell of this compact bone. And this cell, uh, the cell in the compact bone are osteocyte. Okay, so the older cell. So osteocyte, this is the one that will maintain the compact bone. Okay. So the middle part, all of this is a matrix. Okay, that consists of the calcium mineral as a ground substances and collagen fiber. Okay. So this matrix will be hard and strong. Okay, the hardness is coming from the calcium. The strength is coming from the collagen fiber. Now, between the lake, between the lacuna, is it connected by, I'm going to use the blue color to make connection. Between one lake to another lake, it is connected by canal. Okay? And this canal is called the canaliculi, which is canal that connect between lake. So this is how the compact bones look like. Okay, so you see under the microscope, again, compact bone will be consist of units called osteon. Okay, and then if we make the osteon bigger like this, then in the each osteon there will be central canal with lamellae. Okay, and then there will be lake or lacuna that has osteocyte in lacuna. Okay, and then lacuna will be connected to one another with canaliculi. And the 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 basic matrix of these osteons will be calcium and collagen fiber that will give this compact bone the hardness and the strength. So the compact bone will be very hard and also strong. Okay, that's the compact bone, how it looks like. Now, how about the spongy bone? Okay, spongy bones. Remember again, if we make this spongy bone mostly at the end of this long bone. So this is the location of spongy. Now, if we see it closely under the microscope, okay, if we take this area, then there will be structure that look like antler. Okay, like a deer antler. Okay, so this each of this unit is called trabecula. Okay, and then the area between the trabecula, I'm gonna make it red color over here. Okay, the area between trabecula is called red bone marrow. And this is the place for blood cell production. Okay, so blood cell production is occurring in this red bone marrow, which is space between trabecula. Now, if we cut this trabecula, let's say like this, and cut in cross section, then we're gonna see structure like this. Okay. Okay. So this structure will have a lot of cells that build the bone. And remember, this is Bob, the builder, which is the osteoblast. So osteoblast mostly located in the spongy bone, while the osteoclast will be located in the compact bone. There will be also the osteoclast found it. Okay, in the spongy bone. Okay, so most of the osteoclasts will also located in the spongy bone. So this is how the spongy bone look like if you compare with the compact bone. Again, compact bone mostly has the osteocytes, while the spongy bone mostly have the osteoblasts and osteoclasts. Okay, that's the difference between two type of bone tissue, the compact bones and the spongy bone. Now we will learn a little bit about bone as an organs. So we're going to talk about bone as a tissue, bone as an organ. Right now we're going to talk about bone as an organs. Okay. So there are 5 types of bones in our body as an organ. The first one okay, 5 types of bone as organs. The first one is called long bones. And from the name, you know, these bones will be long, yeah, shaped uh, like a stick or long bone. So maybe look like this. Okay, so like our humerus, our femur, this is a type of long bones. Second one is called short bones. So the bones are short. Right? Example is in our wrist, we have actually 8 bones over there. So if it is our hand, we have 8 bones in our wrist. Okay. So these wrist bones over here, they are all short there are 8 wrist bones. Okay, all of them are type of short bones. The third type of bone is called flat bone. Okay. Example of flat bone is the hip bone. So our hip bone, okay. So these hip bones over here is flat. Okay. This is femur, which is long bone. Okay. And the fourth type of bone is called irregular bones. Example is vertebrae. So we have 26 vertebrae or backbone, and all of them have different shape. So therefore they are irregular bones. And the last one is called the sesamoid bone. This is bones that's located in our knee. It's called the kneecap or patella. So kneecap is a type of sesamoid bone. So these are the 5 different type of bone based on shape, okay, as an organs. Okay, next one we will learn a little bit about the long bones. So if we see the long bones, what are part of this long bone? So we're going to learn about part of a long bones. So long bone has 3 main parts. The longest part over here in the middle, this part is called the shaft of the bone or diaphysis. Okay, the shaft of the bone is called the diaphysis. And the end of the bones over here, okay, is called the epiphysis. Okay, and then between the epiphysis, so this is also epiphysis. Okay, between epiphysis and diaphysis, this is area is called the metaphysis. Okay, so there are 3 area of the long bone: epiphysis, metaphysis, and diaphysis. And diaphysis is the longest part or the shaft of the long bones. Now, we have learned that mostly the diaphysis consists of compact bone. Okay? So the tissue on this part is mostly compact bone. The metaphysis and epiphysis mostly consist of the spongy bone. Okay, so the tissue is a spongy bone tissue in the epiphysis and metaphysis. Okay, and then this is very important. If we're still young, we're still growing, our bones still able to become longer, it is due to the area between the metaphysis and epiphysis that actually grow the bone. And this area is called the growth plate. Growth plate. Okay, so the area between metaphysis and epiphysis that will make the bones become longer and will become taller, it's called a growth plate. And because this is mostly located in the epiphysis area, another name for growth plate is epiphyseal plate. Okay, so this is the area between metaphysis and epiphysis that has a lot of cells that multiply. The one that will make the bones become longer. And then as individual, we are become taller, which is growth. Now, when we older, this growth plate is actually gone, become epiphyseal line. It is not plate anymore, it's become line, and there will be no growing after that. So these epiphyseal lines usually develop when the women or girls reach 21 years old. Okay, so this is for girl. Okay, girl reach 21 years old, they usually will not growing anymore. So this is the average age of girl that will not become taller anymore. They stuck, okay, after 21 years old. For boy or female, they still be able to grow until 25 years old. Okay, so this is the reason why sometimes, during the uh, elementary school or maybe middle school, mostly the girls will be growing faster because they get maturity faster. And then after that, after high school, college, and etc., the boy will mostly pass the growth of the girl. So now the boy is become taller and taller when they, you know, maybe high school, senior, junior, or the college ages. Okay, so that's the area between the epiphysis and metaphysis that's used for growing. It's called the growth plate or epiphyseal plate. When the girls reach or the female reach 21 years old, that plate become line and the girls will stop growing. For the male, it can reach until 25 years old. After the 25 years old, the plates become line, and the boy usually also will not growing taller anymore. Okay, so that's the part of the long bone. We will talk about bone formation, how the bone is formed or made. So osteogenesis, the formations of bone. There are two types of osteogenesis. The first one is called the intramembranous ossification. The second type of osteogenesis is called the endochondral ossification. Okay, the intramembranous ossifications will form flat bones. So flat bone is made by intramembranous ossification process. So flat bone, like our skull, is a flat bone. There is breastbone, is called the sternum. Sternum is also flat bone. Our hip is a flat bone. It is made by this intramembranous ossification, okay, during our embryonic development in our mother wombs. And then for the endochondral ossification, this is the one that forms the other type of bone. Okay, long bones, short bones, and irregular bones mostly will also produced by endochondral ossification. Okay, so two type of ossification or bone formation. The first one is intramembranous ossification. The second one is the endochondral ossification. Now, how that process happening? We're gonna start with the endochondral ossification because it's easier to uh, learn or to see the process. So endochondral ossification is start with template. So the template of the bones will be made during our embryonic development. Like for example, our humerus, which is the bones on the upper arm, it start developed by cartilage. So this is cartilage template. Okay, and then after that, the osteoblast will carry a lot of calciums. So calcium will develop this template, and then this area, the middle part, then become harder. Okay, so this harder part become the shaft later. Okay, and then the calcium will also be deposited in the area between epiphysis and metaphysis. This is going to be secondary ossification center. Okay, the middle one over here on the shaft is the primary ossification center. And the secondary ossification center located between epiphysis and metaphysis. This is the reason why the shaft of the bones will be harder because it's developed earlier, while the epiphysis and metaphysis, they become harder later, especially when we get really old. This area the end area of the bones is become solid, just like a compact bone. Okay? So when this one develop, okay, become compact bones over here, okay, some harder bones, they still have the cartilage left in the middle between epiphysis and metaphysis. This is the growth plate. Okay, so the growth plate is actually cartilage that consists of cells that will divide. Okay, so this is growth plate, which is cartilage. It's finally become solid also when the girl reached 21 years old and the boy reached 25 years old. And the end of the bone over here, I'm going to use blue color, will also stay as a cartilage. Okay, so the end bone, it will stay as a cartilage. And this actually will help us to reduce the friction between bone. So the bone is actually connected with another bone, and then it will make us able to move. So each of these bones will have cartilage at the end. So that cartilage is called the articular cartilage. Cartilage that used for joint. Articulate mean joint. So this is the development of long bone. Okay, it's made through the process called the endochondrial ossification, and it always start with a template. There is always template for the long bone and short bone. Okay, they're made by endochondrial ossification. For the intramembranous ossification, there is no template. No templates. Okay, so basically the ossifications will just go to the space that available. So it will make the bones become flat. So ossifications, and mostly the ossifications will be happening at the side of the bones, in peripheral side. Okay, it is the reason why the peripheral side will be compact, will be hard. But the middle area over here, they mostly gonna be spongy. Okay, so flat bone mostly have the spongy bone tissue compared to long bone. It is the reason why the bones, the bone that produce the red blood cell, mostly the flat bones, like our hips, for example. Our hip is the main area for making red blood cell because hip bone is flat, and flat bone has a lot of red bone marrow because they have the spongy type of bone. Okay, so this is how the bone are formed during our embryonic development. And again, just remember for the endochondrial, it start with a template. If we're making a cake, so endochondrial is just like making cupcake, right? So you have to have a template, which is cup. Okay, so in making cupcake, it is similar to making this endochondrial ossification. There is a template. There is a space that will shape like the bones that will be formed. Like the humerus is long bone. When it is developed, it will be template for that humerus. Okay. So how about the intramembranous ossification? It is just like making the what you call the cake that do not template is like pancake, right? So pancake usually just throw the the ingredients or the thing that you're gonna make a pancake on the pan, and it will be flat. It will be flat cake. But the cupcake, it will be like the cup that you put or the template that you use for making that cake. So this is that just for examples of similarity between the formations endochondral ossification and intramembranous ossification with making cake. So at least you know what happened during our embryonic development. So the long bones will have a lot of templates in it, but the intramembranous ossification will not have template for making the bone. Okay, so let's say if this is our body, okay, so this is humerus, for example, there will be template for making humerus. There is a radius and ulna, there will be also template, and they will have the wrist bones, carpal, metacarpal, digit, they all will have templates. For the flat bone, like this skull, okay, this is flat bone, this is long bones. There will be no template for flat bones during the embryonic developments in our mother wombs. Okay, so this is the formation of bone, whether long bone or short bone. Now we're going to talk about bone growth. Okay, because there are two types, which is growth in length. Okay, so this is the one that make us taller, and growth in thickness, in width. Okay, it will make the bone thicker, but it's not longer. So growth in length, we mentioned before, is located in the area. It's called the growth plate. Okay, so there is an area over here between epiphysis, okay, and metaphysis. Okay, this middle one is diaphysis. Okay. This is an area over here. It's called the growth plate, okay, or epiphyseal plate that will make our bones become longer. So in this area, in this growth plate, there are three types of zones or area. The first one is called the zone of resting cartilage. So mostly it's going to be cartilage cell because this cell still be able to divide. And then the next one is called the zone of proliferation cartilage. Okay, so this consists of cell that dividing. And then after that, some cell, after it's dividing, it's become solid a little bit because the calcium will be placed on that zone. And that zone is called zones of hypertrophic hypertrophic cartilage. Okay. And then the last ones will be the zones that become solid, okay, become part of this bone later. Okay, so it's gonna be push the bones in the middle become longer, okay, on the top, on the bottom become going to the bottom area. So the shaft become longer and longer. So that zones that really close to the shaft area is called the zones of calcified cartilage. Okay? So this zone will have a lot of calcium deposit on it. Okay? So it's become harder. So this is the harder zones. And later the harder zone become part of the crisis and the bones become longer. This is how the bones growing in length. Bones growing in width or thickness. Okay, let's say we have these long bones. Okay, we're gonna cross sections on the diaphysis. And we're gonna see this again. A lot of osteons in it. Okay, so when the osteon is growing, so on the side over here, it's gonna be adding the thickness of the bone. So the bone become thicker and thicker. It's actually going to the side. Okay? So this is how the bones become thicker by additions of osteons. Okay, so formation of osteon. So osteon will be growing to the side. That will make the bone become thicker. Okay, so when we young, for example, our bone is relatively skinnier, eh? Then it's gonna be developed into thicker bone by adding the osteon. Okay, so that's the bone growth in thickness or in width. Okay, the last one will be the conditions that affecting the bones growth. So factors affecting bones growth. Okay. First, of course, our nutrition, our food. Okay. So in order to make our bone growing, and also become harder, we need calcium in our diet. So calcium is really important nutrition for bone growth. The second, our nutrition also require to have vitamin D. Okay? So this vitamin D will increase calcium reabsorptions in our intestine. So if we eat food that have a lot of calcium, then we also need vitamin D in order to increase the reabsorption of calcium that we eat into our blood and finally will be delivered into the bone. So again, calcium will make bones become harder, eh, and also growing taller. We also need vitamin C, okay, for bone, and this is the one that used for making other matrix, which is collagen fiber. Okay, so the solid calcium, it actually make the ground substances become harder. The vitamin C is needed to make the bone become stronger, which is formations of the collagen fibers in the bones. There are some other vitamin that also needed for bone growth, vitamin K and B, especially B12. This is needed for protein synthesis. So fiber over here, collagen fiber, mostly made of protein. So the vitamin K and B12 also needed for making this collagen fiber and some other proteins. Second is hormones. This hormone is produced by our endocrine glands. The first hormone needed is called growth hormone. Okay, growth hormone. It is produced by anterior pituitary gland, which is the gland that's located under our brain. Okay, this is in close to our brain. So this growth hormone is really important for growing of the bone. The second hormone is called calcitonin. Okay. This is produced by our thyroid gland. And this calcitonin is needed to stimulate osteoblasts. Okay. Remember, osteoblast is the one that build the bone. So this osteoblast activity will be stimulated by the calcitonin. So these hormones are really important to make our bones become harder and also growing taller and thicker. Okay. And the last one is exercise, okay, especially weight bearing. Okay. It will make the calcium depositions become faster and what you call this compact. Okay, so when we do exercise weight bearing, just like you put the sand on the back, okay? If you push that with, you push that, it will be more sand will be put on that bag. But if you don't push it, it's gonna, the sand is not that solid. Yeah, so that's the reason why. Uh, the same like your bones. If you do the weight bearing, then more calcium will actually deposit it into the bone, and the bone become harder. So that's the some factor that increase the bone growth. Now, what happens if growth hormones? Okay, remember, this is the very important hormone used for growing. What happens if the growth hormone is produced too little? It's called the hypocreasance of growth hormone. Uh, When it is happening, then the individual become very short. It's called dwarfism. Okay, it's not enough growth hormone causing the individual become dwarf. What happens if the growth hormone is produced too much? It's called the hypersecretions of growth hormone. Then the individual become giant. This disorder or abnormality is called giantism. Okay, it's a very tall individual. It's telling us all that individual actually produce too much growth hormone. Maybe there is a tumor on their brains, on the anterior pituitary gland, that causing him to produce more growth hormone than normal. Okay, I think that's all for this bones issue. We will continue in the classroom on the bones remodeling, which is when our bones broken, then we still have the ability to remodel or to uh, recover the broken bones. So our bone is actually will be able to develop, will be able to cure from broken bone. So that process is called the bone remodeling and repair. So our bone have the ability to remodel and repair the broken bone. I think we finish for today. I'll see you next time. I'm gonna. Hello everyone. So today we will discuss joints. So what is joint? Joints or articulations or arthrosis is a point of contact between two or more bones, between cartilage and bones, or between teeth and bone. So basically, joint is a point contact between bones and another bones. There are several types. If you see this, you see the joints in the skulls. So there are several bones that join together. So this is a type of joints also. And if you see in the legs, there is a tibia and fibula bones. There is fiber that connect them. So this is another type of joint. And this is a very typical type of joint located in the knee. And this is also another joint between the teeth and the bones, like in the mandible or maxilla, lower jaws or the upper jaw. Okay, there are type of bones, so it can be classified based on structure or anatomy, or it can be also classified based on functions or the physiology. Now, based on the structure, how it look like, or what type of tissue that make up the joint, there are three types of joint. The first one is called the fibrous joint. And this name telling you there are a fiber connective tissue that joins one bone with another bone. So this is fibrous connective tissue. The second type is called the cartilaginous joint. And the name is also telling you there is a cartilage that joins one bone with another bone. And the last one is called the synovial joint. This is the regular joint that we know, which is the joint that have a very complex structure, and they usually have what we call the synovial cavity. Okay. So based on the functions, mostly about movement, there are three types of joints also. The first one is called the synarthrosis, which is type of joint that unable to move. So this is immovable joint. The second one is called the amphiarthrosis. This is the type of joint that give a very little movement, a slightly movable joint. And the last one is called the diarthrosis, which is the type of joint that we know that give the free movement. So this is a freely movable type of joint. Mostly the fibrous joints, they are synarthrosis. Okay, so most of the fibrous joint, they are immovable joint. Most of the cartilaginous joints, they are amphiarthrosis, so give a slight movement. Some synarthrosis, okay, unable to move. And of course, the last one, the synovial joint, which is the joint that we know usually. This is the one that give all the diarthrosis or freely movable joint. So just remember this, all, okay, so all synovial joint, they are diarthrosis. They are freely movable joint. Now we start with the first type of joint, the fibrous joint. So this is based on structure. So this is the type of joints that have fiber, mostly dense connective tissue, okay, with many collagen fiber that bind two bones together. There are three types of fibrous joint. The first one is called the syndesmosis. So these syndesmosis, they are only located in two places in our body, which is between tibia and fibula. Okay, so between tibia and fibula here, and also between the radius and ulna. Okay, so to put another one over here, and between radius and ulna. Okay, so this is located in the lower arms and also on the legs. Okay, so you see this is a fiber that connects these two bones, okay, radius and ulna, and the one that connects the tibia and fibula. Okay, from this, we should be able to guess that there will be slight movement, okay, between these two bones. So this syndesmosis, mostly amphiarthrosis. a slightly movable joint. The second type of fibrous joint is called the suture. So suture is actually type of joint that's located in our skulls, mostly in the cranium. You see, we have frontal bones over here. We have two parietal bones. We have occipital bones on the back, and we have the temporal bones on the side. So if you see, these bones are connected with this joint. So this joint is called the suture. Okay. Now there are, if you see this, there are 4 types of suture on our cranium. The first one is this one over here. Okay, this is the first suture, which is between the frontal bone and the 2 parietal bones. Okay, so this one. So this is what we call the coronal suture. So this is the first type of suture. The second one is the one that's located between the 2 parietal bones. So the blue one over here, I make it blue. Okay, blue joint. And this is what we call the sagittal suture. The third one is the ones that located between the 2 parietals and the occipital bone. Then gonna be this one. So gonna be, okay, and this is what we call the lambdoidal suture. So this is number 3, and the last one, I'm gonna use the same yellow color over here, is between the parietal bones and the temporal bone. So this suture is called the squamous suture. Okay, and of course we are unable to move our cranium. Okay, even though we have a joint between the bones in the cranium, we are unable to move it. Therefore, the functional type of suture are synarthropes. So this is immovable type of joint. Now the last type of fibrous joint is called the gomphosis. The gomphosis is joint between teeth or tooth and the bone, okay, which is the upper jaw or the lower jaw. So this is what we call the gomphosis. And we should know that the gomphosis should be synarthrosis. So this is immovable type of joint. So if you're able to move, or if the teeth or the tooth is actually moving in the socket, it means that there is a problem with our tooth. It should be stay. It is immovable type of joint. Okay, now the second type of joint based on structure is called the cartilaginous joint. And again, this is a joint that made with cartilage. Okay, there are 2 types of cartilage that connect the 2 bones, whether hyaline cartilage or the fibrocartilage. Therefore, based on this type of cartilage, there are 2 types of cartilaginous joint. The first one is called the synchondrosis, which is made of the hyaline cartilage. So the bones are connected with the hyaline cartilage. Example is the joint between the sternum, okay, the breastbone. Okay, so this is the sternum with the ribs. Okay, so the ribs, we have 12 pairs of ribs, okay, and 7 of them are connected directly to the sternum with this type of cartilage, which is hyaline cartilage. Okay, so this is a type of synchondrosis. And these ones, okay, they are synarthrosis. This is immovable type of joint. Okay, so synchondrosis, they are immovable type of joint. The second type of cartilaginous joint is the symphysis. Okay, symphysis, this is the one that have fibrocartilage. So fibrocartilage is the strongest type of cartilage. Examples, we have two places that have this symphysis. The first one is between the hip bones in our pubic area. Therefore, the name is called this one over here is called the pubic symphysis. Okay. And the second location is between the vertebrae. So between vertebrae, we have what we call the intercalated disc that's actually made of fibrocartilage. So this connection between one rib, one vertebrae with another vertebrae using this fibrocartilage is called the symphysis. Okay, so this is another type of symphysis. So can we move? Yes, we can bend our back, for example, or there is a little bit movement between the hip bones in the pubic symphysis. Therefore, this symphysis will be amphiarthrosis. There is a slightly movement between the bone. Okay, the last one, the last type of joint, okay, is called the synovial joint. And again, this is the joint that usually we know as a joint, because this is the joint that all of them are diarthrosis. This is freely movable joint. Okay, like for example, joint in our shoulder, in the knee and the elbow, we can move. We can move. There is a movement, freely movable joints on that area. So this is what we call the synovial joint. It has a complex structure, and they also have additional structure that make this joint stronger. So there are several structure or components of synovial joint. The first one, there is an area of the bone is called the articular cartilage. So usually located at the end of the bone. Yeah, I can make yellow color over here. So each bone at the end will have the cartilage. Okay. And this cartilage, because located in the articulation in the joint area, is called the articular cartilage. And what's the function for this one? This articular cartilage will reduce friction, okay, between the bone, okay, during movement. And then the second part gonna be the what we call the capsule, capsule that cover the joint area. This is what we call the joint capsule or articular capsule. The next one is ligaments. Ligament is fibrous connective tissue that connects one bone with another bones, usually on the outside of the synovial capsule. And this ligament will hold the bone together. Okay, when there is a movement, it will strengthen the structure. And synovial membrane, okay, synovial membrane is part of the joint capsule that located inside. Okay, so this is actually the inner membranes of the capsule. Okay, this is what we call the synovial cavity. And this synovial cavity produce a fluid, okay? And that fluid is called the synovial fluid. And this fluid will fill the area between the bones inside this capsule. And the function for this synovial fluid is for reducing the friction, just like oils in the engine. They will make the movement between the bones becomes easy. Okay, and there are some other components. Okay, in some joint, like there is a meniscus. Okay, this is meniscus, and this is actually cartilage or hard components that will give the shape for the joint. And bursa is a empty space that's located in some joint. Sometimes, okay, bacteria can cause infection in bursa, and that infection is called the bursitis. Okay, so bursitis is infection of bursa by mostly bacteria. Okay, inflammation of joint area. Okay, so this is the components of synovial joint. Now, there are several types of synovial joint, and based on the structure, there will be six types of joint or synovial joint. The first one is called the plane or planar, or sometimes it's also known as a gliding joint, because it gives movement of gliding or rubbing between the bone on this type of joint. The second one is called the hinge joint, just like hinge in the door. So the structure is very similar. Pivot joint, condyloid joint, saddle joint, and ball and socket type of joint. So these are the six types of synovial joint based on the structure. Now, based on the movement, just remember all the synovial joint, they are diarthrosis, okay? So freely movable joint. However, there are several types of movement for the diarthrosis. The first one is called the gliding movement, rubbing movement between the bone. And this is usually present in the planar type of joint. So planar will give gliding movement. The second one is called the angular movement. From the name, this is angle over here. So the angular movement is the movement that changes the angle between the bone. There are several types. The first one is flexion. So flexion is actually movement that reduces the angle. Like for example, if you flex your elbow, okay, the angles between the humerus and radius ulna will be reduced. Okay, is flexion. Extension, this is the one that increase the angle. Okay, if you extend your elbow, for example, the angle will be increasing. And if we perform the extension that is over or higher than 100-degree angle, it is called the hyperextension. Usually you cannot do it with your elbow, because your elbow only gives the highest angle 180 degrees, which is the straight line. You cannot perform with this elbow, the hyperextension, but you can perform with, for example, with your hip joint. Okay, we're gonna see the examples later. Okay, and there is a movement called the abduction. Okay, so abduction, just remember abduction, just like a kid is abducted by the alien. So it is away. So away from the midline. Okay. And the opposite of abductions will be adduction, which is going toward the midline. Okay. And the last one for this angular movement is called the circumduction, which is type of movement that give a cone shape. Okay, like for example, if you move your shoulder, if you make a circular movement of your shoulder, it will give this cone shape movement, and this is what we call the circumduction. The next one, okay, for the angular movement, usually hinge joints will give some angular movement. Condyloid can also give angular movement, and ball and socket will also give the angular movement. The next one is rotation, which is the movement of your body on the axis. Okay, example, when you say no, no, with your head will rotate to the left and to the right. So this is rotation. And usually the one that give rotation type of movement is the pivot joint. So pivot joint will usually give a type of rotation. And the last one is called the spatial movement. This is special movement on special area, like for example, on the mandible and lower jaw, you can move into 4 types of movement. Over here. Okay, when you move your jaw forward, this is called the protraction. If you move it inward, then it is called the retraction. If you elevate your jaw, like when you're chewing the food, for example, it gives the movement called the elevation. And when you chew the food, sometimes you also depress or move downward of your mandible, of your lower jaw, and that movement is called the depression. In the foot, ankle, there are also 4 types of spatial movement. When you inverse or move your ankle inward, this is called the inversion. If you move it outward, this is called the eversion. So this is inward. Eversion is outward. And then there is a dorsiflexion when we flex our foot up. And when we flex the foot down, it's called the plantar flexion. On the arms and also our hand, we can make a 2 movement. It's called a special movement called the pronation and supination. We're going to see the examples right here. Okay, so this location, some location of the 6 structural type of synovial joint. Again, the first one is the planar joint. Example is the joint between the navicular and the second and the third cuneiform bone. Remember, this is located in the ankle. Okay, so the movement is going to be gliding left to right, like when we move our foot inward, inversion. Okay, and also eversion, outward. This is actually done by this type of joint, okay, the planar or gliding joint. Okay, the second type is hinge joints, like for example, between this humerus and ulna. This is elbow joint. Okay, so it will give some angular movement like flexion and extension. Okay, this is the third type, the pivot joint. You see the whole structure over here, and there is a bones that actually fill that hole. And what happens? We able to move our joints, rotate our joint, and this is the rotation. Okay, for pivot joint, the movement usually rotation. The next one is condylar joint. So you see that type of joint over here. There is a little bit process, and another bone will have a little bit depression. So you can make a little bit like this. Okay, there is a process over here, and there is a depression over here, like a little bit depressions in the bone. So this is type of condylar joint. Example is between the scaphoid and the radius. So this is located in our wrist, okay, in the wrist. And we can move several movement over here. We can move like flexion, extension, circumductions with this type of condylar joint. The next one is saddle joint. It looks like saddle. Example is located between the trapezium and the first metacarpal. So this is in our hand, in our wrist area also. And the movement, okay, usually kind of flexion and extension type of movement. And the last one, this is ball and socket. And this is the type of joint that can give almost all type of movement, because this is very, very freely movable type of joint. We only have two type of ball and socket joint, okay, which is the first one is in shoulder. Okay, so shoulder joint is ball and socket. And the other location is in the hip. Okay, so hip joint is also shoulder and socket. And if you see over here, there is a ball structure, which is a process. And there is a cup structure, or the socket structure, which is actually depressions in the bone. And it's give the ball and socket type of joint. Again, this is the most freely movable type of joint. Now we're gonna see example of that movement. Okay, the type of movement at the synovial joint. This is angular movement. So angular movement is the movement that change the angle. Example, if we use this one, we're gonna use the hip joint over here, right? So you can flex the shoulder, I mean the hip. So what happens? The angle over here is become lower. Okay, so from let's say 100 degree and then lower into maybe 90 degree. Okay, that's flexion. If we increase the angle, let's say from here 90 and then boom, going to 180, and this is what we call the extension. We can move more than 180. Let's say this over here. Okay, maybe 270 degree, and this is what we call the hyperextension. Okay, another angular type of joint. This is in the knee joint. When we move this knee, which is decrease the angle, is become flexion, and we can also extend our knee extension, which is increase, let's say from 90 to 180. So this is extension. Elbow, the same thing, only two type of movement, which is flex your elbow. So it's lower the degree. So this one may be from, let's say this is 145 degree into only 90 degree. So this is flexion. If you increase it from 90 until, for example, 180 degree over here, straight line, let's say this is straight line, then the movement is called the extension. The same thing with your wrist. You can also move, reduce the angle, flexion, increase the angle, extension, increase more, more than 100 degree. This is the hyperextension. Our shoulder, the same thing. We can flexion, and then also hyperextension, or maybe just extension. This is abduction and adduction. So remember, abduction means away. So this is midline, so our body. So away from the midline is called the abduction. Moving toward the midline, okay, this is what we call the adduction. And the same thing with our hip. We can also perform abduction away or toward the midline. So this is the midline over here. This is the adduction. With our finger, we can also move away. This is adduction, or move it inside. This is adduction. So this is adduction, moving inside. Adduction, abduction, away. And this is when we move circular movement with our shoulder, it can give the circumduction type of movement. The same thing with the hip joint. When we make a circular movement of our legs, it will give the cone type of shape. So this is what we call the circumduction. Same thing with this one, also give the cone shape of movement. This is what we call the circumduction. Rotation, this is example rotation. When we rotate our arm, inside is going to be medial, because this is median, middle part of our body. And it's going to be lateral when we move it out from our body. So this is a lateral rotation, and it's going to be medial rotation. Example of special movement, I mentioned before, movement of our jaw over here. When it is up, it's called the elevation. When it is down, it's called the depression. When we move it forward, this is protraction. When we move it inward or backward, this is retraction. Okay, now on the foot, on our ankle, if we move it inside, it's called the inversion. If we move it outside, it's called the eversion. If we flex up, it's called the dorsiflexion. If we flex down, then it is plantar flexion. This is pronation and supination. Remember, prone position is actually when we stand and then we lay down on the bed, okay, the prone area of our body is actually in the dorsal of our hand over here. So we move our hand or our arms to this dorsal area, and this movement is called the pronation. If we flip our hand and we show the palm, that movement is called the supination. So when you're flipping your hand and showing the palms, that movement is supination. If you hide the palm, that movement is called the pronation. Okay, now we're gonna use several examples of joints: shoulder, elbow, hip, and the knee. So as examples of synovial joint. We start with the shoulder. And of course, you see in the shoulder, there is a ball structure and the socket structure. So the ball is actually the head of the humerus, and the socket structure is actually the cavity of our shoulder blade. So this is glenoid cavity. So it's making the ball and socket type of joint. The head of humerus and the glenoid cavity making that type of ball and socket joint. And there are several ligaments that make this joint become stronger. There are 3 of them: coracohumeral ligament, glenohumeral ligament, and transverse humeral ligament. So this is actually tell you the positions at the ligament between the coracoid, which is part of the shoulder blade, and the humerus bone. Glenohumeral, this is between the glenoid cavity, which is part of the shoulder blade, with the humerus bone. It's give this ligament. So this ligament, coraco ligaments, glenohumeral ligament, and the transverse humeral ligament, transverse straight. And these are the 3 main ligaments in the shoulder that give strength to the shoulder joint. So we can move our shoulder joints easily, and that movement will keep the bones in place because of this ligament. The next one is the elbow joint, which is the connection or the joint between the humerus, the upper arm bone, and the 2 lower arm bone, which is the radius and ulna. So radius is the bigger one, and ulna is the smaller one. Now, there is a connection over here, and this connection is called the hinge joints. The hinge joint, actually, there are 2 in the elbow joint. There are 2 types of joint. This is hinge and planar. You know, the straight type of joint, a flat surface of joint, it will give the plane, and the planar or gliding type of joint. So basically, there are 2 types of joints located in the elbow joint: hinge and planar. And there are also ligaments that make this joint become also stronger. The first one is radial collateral ligament. So this is radial ligament, and then ulnar ligaments, the bottom side, and the annular ligament on the other side. So from the other part of this joint. The next one is hip joint. And hip joint, the same like a shoulder joint. It has a ball structure, which is the head of the femur, and the socket structure, which is part of the hip bone, is called the acetabulum. So acetabulum is actually the socket of this joint. Okay. And there is also three type of ligaments that strengthen the hip joint. The first one is called the iliofemoral ligament. Okay, so this is iliofemoral ligament, which is between ilium and the femur. And then the pubofemoral ligament, which is between the pubic bone, the pubis, and the femur. So therefore it's called the pubofemoral ligament. And the last one is ischiofemoral ligament, which is between ischium. This is ischium part of the hip, and this is the femur. So it's connecting these two bones. Okay, so it's called the ischiofemoral ligament. Okay, the next one is a knee joint, and in the knee joint there is also hinge and plan. Okay, so planar or glidings. The hinge is located between the femur here and the tibia. There is a hinge type of joint. And the plan or the gliding joint is between the femur and the tibia. You see the flat structure over here. When it is moving, like flexing or extending the knee, there is a rubbing movement between the patella and the femur. So this is a type of gliding joint or planar joint. The ligaments, it has more complex ligaments compared to the shoulder, the elbow, and also the hip. So this is actually a very strong type of joint. Okay, there is a patellar ligaments between patella and the femur, oblique popliteal ligament. Okay, and arcuate popliteal ligament. A little bit smaller over here. Tibia collateral ligaments. Let's say from the side. And then fibular collateral ligaments. There is anterior cruciate ligaments, and this is sometimes the one that is broken when someone play sport like a soccer or maybe kickballs, okay, because they're using that knee very hard. So sometimes this small ligament over here can be broken. So this is cruciate ligament, posterior cruciate ligament, which is on the back, which is under the anterior cruciate ligament. So these are several ligaments that strengthen the knee joint. Okay, now we go to the last one, which is the joint disorder. This is the condition when the joints have a problem, maybe because of the sport or because of older age, because of the less production of synovial fluid, for example, it can cause problem to the joint. Like, for example, dislocation, which is displacement of articulating surface, common in shoulder, knee, okay? Sprain, it is common in the ankle, yes, sprained ankle, for example. Torn ligament, because of twisting, overextensive use of the joint can break the ligament. Bursitis, I mentioned before, this is inflammation of bursa due to infections, and sometimes also used because of overuse and stress. And then arthritis, there are several types of arthritis, and that is inflammation of joint in general. Rheumatoid arthritis, this is due to antibody that actually kill our own joint cell. So this is what we call the autoimmune disease. Osteoarthritis, this is usually happenings when in the older age, which is the degenerative of joint problem. This is most common type when people aging. Lyme arthritis or Lyme disease, and this is because of infections of bacteria, and this bacteria is carried by the tick. Okay, so bacteria, the one that causing this infection, and usually this bacteria is carried or transferred from animal into human by the tick bite. There is another one, it's called the ankylosing spondylitis. This is usually affecting joint between vertebrae. Sometimes the cause is unknown. So there is sometimes problem between the joint between vertebrae without unknown case, and this is called the ankylosing spondylitis. There is a process, it's called the joint replacement, to replace the joint, the broken joint, mostly like in the hip area is the most common place for replacement. So hip replacement, sometimes in the knee area, also knee joint, there's a knee joint replacement. There are several technology that used for this joint replacement, usually using material that resemble to natural body chemicals, using 3D printing technology, sometimes using steel and titanium to replace the large joint area. Silicone is used for smaller area. And aging and lifestyle changings. When we get older, then there are some problem with the joint, like joint stiffness. This is usually the early sign for aging. So it's difficult, more difficult to move in the some joint area. Arthritis, especially osteoarthritis, this is due to the reduced production of the synovial fluid. The fibrous joints will also lose the strength over years when we get older. Cartilage also become stiffened, like harder, just like the bone. Some ligament will lose the elasticity. Changes in symphysis joint, so there is a less flexibility in our movement in the pubic area. Synovial joints lost their function. Disuse or less nutrient supply to the joint, and it will speed the hardening of the cartilage. Activity and exercise, usually will keep the joint's functions longer. I think that's all for this chapter. So we finish with discussions joints. So we'll see you again for the next chapter. Thank you.